Good morning and good afternoon to everybody here in the room at the Western Pacific Regional Office of WHO, and to everybody joining us online. Really delighted to have you with us. We have a press conference today about the Regional Committee meeting, which is taking place here in the WHO Regional Office for the Western Pacific in Manila next week. And without further ado, I'm going to hand over to our Acting Regional Director for the Western Pacific, Dr. Susana Jetta. Go ahead.
Thank you very much, Liv, and good morning, good afternoon, everybody. Welcome to all the journalists, both here in Manila and also online across the Western Pacific region. I'd like to thank you very much for joining us for this background briefing on the 74th session of the Western Pacific Regional Committee of WHO, which will take place here in Manila next week. The Regional Committee, as you might know, is our most important governing body, which takes decisions on policies, on strategies, on budget, and holds the Secretariat accountable for the commitments and the decisions. And it is made up of ministers of health and senior representatives, both from the Ministries of Health, also Ministries of Foreign Affairs, of the 37 countries of the Asia-Pacific region, which basically constitutes quarter of the world's population. So this is a very important event for us. I would say the most important event every year, for which we are preparing throughout the year. And whenever we finish a regional committee, we start already the preparations for the next one. And this regional committee is of particular importance for us for two reasons. Partly because we are celebrating the 75th anniversary of WHO. And you might recall that a couple of months ago, we already had a press conference with you to discuss the major achievements, but also the challenges that we still face in this region. But secondly, it is also a very important event next week because the member states will vote to nominate the next regional director of this region, who will take office later on the 1st of February 2024, and who will have this office for 5 years. You may recall that we had a candidates forum on the 15th of September, which was the first candidates forum that we organized in this region, which was also followed by a similar candidates forum by the Eastern Mediterranean region. And I am sure, due to the feedback that we received, which was overall very positive, I am sure that WHO will institutionalize these candidates forums in the future. And there will be a discussion on this in the executive board later on this year and early next year. The reason why we wanted to have this candidates forum is partly to ensure transparency of the process, partly also to facilitate the decision-making role and decision-making process of the member states. It was just 1 month before the regional committee takes place. So this is the perfect time when member states are all discussing which candidate they should support. Looking at the candidates, the election, first of all, the election will take place on Tuesday, which is the 17th of October. So regional committee starts Monday and the election is on Tuesday, the second day. And as you might remember from the candidates forum, that they can choose, member states can choose from among 5 candidates. Dr. Song Li, who was proposed by China, Dr. Susan Mercado, proposed by the Philippines, Dr. Jimmy Rogers, proposed by the Solomon Islands, Dr. Saya Mau-Piukala, proposed by Tonga, and Dr. Tran Thi Giang Huong, proposed by Vietnam. And the interviews and the voting will take place in a closed door session, because this is what our rules of procedure requires from us. However, the live stream will resume on Tuesday afternoon to announce the result of the vote. And following this, the process will continue because the WHO Executive Board in WHO headquarters will have to approve the nomination from the regional committee, and that will only take place in January 2024. Therefore, the new regional director will take office on the 1st of February 2024. In addition to the regional director nomination, delegates will also discuss many other important issues and items, and they will agree on actions to be taken to address them. These will also include global as well as regional issues, all of which are priorities for the Western Pacific region. Among them, there are 4 important technical items on health security, on health workforce, on communication for health, and health innovation. I will come back to these 4 issues in a minute to give you more details. Other issues that will be addressed are governance issues and particularly rules of procedure, some updates, then implementation of some of the global decisions that emanate from World Health Assembly and Executive Board, and also the transformation of the regional office to ensure that it is a respectful workplace. And with this discussion and with the ongoing work, we want to unlock full potential of our organization and staff. So this takes me now to the 4 technical items that I would like to address a bit more in details. The first one that will be considered by the member states is the Asia-Pacific Health Security Framework. This framework builds on the achievements of the past 20 years and follows on from 3 iterations of the Asia-Pacific strategy for emerging diseases and public health emergencies. The Western Pacific is no stranger to public health emergencies. Infectious diseases like COVID-19, the spread of antimicrobial resistance, the extreme weather events due to climate change are becoming more frequent and more destructive. The risk and complexity of these threats is also heightened by population growth, by urbanization and environmental degradation. As demonstrated by the pandemic, we have just been through the impact of public health emergencies, and all the public health emergencies go far beyond health, and they affect the social and economic growth and the development in the countries. They also widen the existing health and social inequities and disproportionately impact the most vulnerable and the hardest to reach. All of these challenges underscore the need for building, strengthening, and improving capacities and systems to rapidly detect, strengthen, respond to, prevent, and recover from any health emergency at subnational, national, or regional levels. This will be the focus of the new regional framework that countries will consider next week in the regional committee. Then member states will also consider the regional framework to shape a health workforce for the future of the Western Pacific, a big priority, both globally and also in the region. The health workforce we have today is not fully prepared to meet the expanding and changing health needs of the region's population. There is chronic underinvestment in education and training of health workers in some countries, and there is also a mismatch between education and employment strategies in relation to health systems and population needs. These are contributing to continuous shortages of health workers. And the problem is compounded by difficulties in deploying health workers in rural, remote, and underserved areas, as well as increasing international migration. The framework proposed this week, or next week rather, aims to ensure the right number of health workers with the right mix of skills in the right places across the region. Member States representatives will also consider the regional action framework for communication for health. Communication, when used strategically, can be a powerful tool to address growing and complex health challenges. It can change people's knowledge, attitudes, and behaviors, and empower them to make choices that help to protect and improve their health and that of their families and community. In the digital age, communication is more important than ever, but using communication strategically requires expertise, skills, and resources. To leverage the full power of strategic communication to improve health and well-being, and to help member states to achieve their public health goals, we have developed and begun using Communication for Health, or C4H approach. C4H is a set of principles and practices to help ensure communication is designed to inform and change attitudes and behaviors in ways that support the achievement of defined public health outcomes, such as increasing the uptake of vaccination or decreasing tobacco use. The framework aims to guide member states on how to take such a strategic approach to communication in order to achieve their health goals. And finally, member states will consider a regional health innovation strategy for the Western Pacific region. Much of the progress in public health historically has been driven by innovation. From the rapid development of genomic surveillance, data sharing, and mRNA vaccines for COVID-19 to mental health chatbots and solar-powered oxygen concentrators, health innovation has improved health and well-being around the world. But despite the diversity and abundance of innovations in the region, many have had limited success tackling health challenges or contributing to population well-being. Health areas with limited market appeal have been marginalized, such as treatment of neglected tropical diseases and development of new antibiotics. This has left behind vulnerable populations with the greatest needs and hindered efforts to achieve health equity. The strategy aims to support member states to foster a conducive environment for health innovation, make use of them, and establish an effective regional mechanism for collaboration and knowledge transfer to reduce health disparities. So these will be the four technical topics on the agenda, the very important ones, which will guide the priorities of this region in the coming years. But then there will also be some other issues that we will discuss, like, for example, the 14th General Program of Work, which is the vision of WHO globally for the next 5 years. And this will be connected also with an attempt to ensure that we regularly monitor the impact and the results in the countries through the agreed indicators with the member states, the so-called impact delivery and result framework. And then also linking to the general program of work, we will discuss an investment round, which means that we would like to find funding for the whole general program of work for the next 5 years already upfront, so that we can avoid that there is pockets of poverty for high priority areas of the work of the member states and WHO. Beyond this, we will also discuss the Pandemic Accord, which is a piece of work that is being developed by WHO in headquarters in Geneva. And at the same time, we are also updating the international health regulations. Both of these issues build on the learnings from the COVID experience, where we have noticed together with the member states a number of weaknesses. And these are the weaknesses that we are addressing now in the Pandemic Accord and also in the international health regulation. And then, as I also mentioned, we discussed the transformation of the regional office, which has been a priority for us in the last 1 year. And we will make sure that this office in every aspect is a respectful workplace where every staff member feels well and is happy to come to the office. And part of this, during this week, we will also take stock of the progress that we have made in our shared vision for the future, which will be on the first day during the regional director's report, and we will report back to the member states. And of course, as all the ministers are here, this will give us a unique opportunity to meet with them and to discuss also bilateral issues and bilateral priorities, signed country cooperation strategies where they are ready, and many interaction with the country delegations. So this is from me as an introduction, and we are here with all my colleagues, directors, and we are happy to respond to any issues, any questions that you may have. Back to you, Liv.
Thank you so much, Dr. Jakob. So we're now going to move into the question and answer portion of the press conference, of course. And those who are connected online, we invite you to raise your digital hand in Zoom or type into the chat so that we can come to you, while those of you who are here in the room can raise your real life hand, and someone will come to you with a roving mic as well. So as you can see from my label, my name is Olivia Law-Davies and I'm the Communications Manager for WHO in the region. And as Dr. Jakob said, we also have a number of other colleagues here in the room who can help answer some of the questions that you might have. You'll see them along the sides here. They lead our work across the region in various technical domains. We've got Dr. Babatunde Oluwakure, who's the Director for Health Security and Emergencies. Next to him, we've got Luis Vinales-Torres, who's our Acting Director of Health Systems and Services. Over here on our other side, we've got Dr. Raj Yadav, who's currently Acting Director for Disease Control in the region. Next to him, Dr. Kidong Park, who is the Director of Data Strategy and Innovation. And finally, we've got Dr. Hiro Okayasu, who is our Director of Healthy Environments and Populations. So when we do the Q&A, as always, we'd ask you to start by introducing yourself so that we know your name and which outlet you're with. And just then you can go ahead and answer your question. And as the moderator, I will try and help figure out who would be the best person to respond. So anyone here in the room who has a question that they wish to ask, please go ahead and raise your hand. I can see we've already got one. Thanks, Alison.
I'm Alison Jackson from Agence France Presse, AFP News Agency. Apologies for arriving a little late. I just wanted to clarify the process for electing the next regional director. Could you just explain, Dr. Jakob, how the actual process will work on? I think the result will be announced Tuesday. Is that correct? Tuesday afternoon. Yeah. If you could just give us some details about that, what the voting process is, and just exactly when the result will be announced, and how that will happen. Thank you.
So this will take place on Tuesday, and actually we plan the whole day to devote to the regional director election. Each candidate will have 1 hour. They will make a presentation first, 30 minutes, and then 30 minutes question and answer from the delegations. And that will take about 5 hours of the time of the regional committee. And then from there on, we move into the voting procedure. And the voting in issues like this is always by secret ballot. So the voting will be by secret ballot, and If someone receives the simple majority in the first round, will be elected. If no one receives the simple majority, then the last one who receives the least number of votes is eliminated from the process. And then we continue with this as long as there are two candidates left. And then from among the two candidates, one of them has to receive the simple majority. So as long as that happens, we have to continue with the process of voting. So we expect that there might be a few rounds of voting unless someone in the first round or second round receives the simple majority. So that's how it is. And we expect that the announcement should be late in the afternoon between 4 to 6 o'clock, something around this time. And we will convene in public as soon as the voting process has been finalized and as soon as it is clear who will be the next regional director, and that will be announced in the public meeting of the regional committee, which will again be webcasted.
Sorry,
So that's how it goes. And this is the first part of the selection process. This is what happens in the regional committee. And the role of the regional committee is to nominate a regional director. And then there is a second process, which will take place at the global level in the WHO Executive Board in January, where they have to appoint the regional director. So there will be one round of formal process at the executive board, and then that will be the final process, and the new RD will take office on the 1st of February 2024.
So on Tuesday, just to clarify, on Tuesday, you'll be nominating a candidate, and then in Geneva, it will be the final decision will be made in January.
Exactly.
Okay.
So the nomination comes from here, and then the appointment from there. But what is most important is always the decision in the regional committee. Until now, the executive board has always followed the decision of the regional committees, not only in this region, but in all the other 5 regions of WHO.
And I'm just, you spoke about having a respectful workplace. I mean, are you confident that any of these candidates, any of these 5 candidates would be able to foster that sort of work environment?
I'm sure all of them will. A lot of work has been done on this in the last 1.5 years. And we have a clear action plan of what needs to be done in the next 3 months and in the coming years, in the next 2 to 3 years and beyond. So our plan is to hand over to this action plan to the new regional director. And as any of the regional directors is very interested to have a well-functioning regional office, I'm sure that they will follow up on this. Not to mention the fact that during the candidates forum, they all addressed these issues. And they were very positive about the process and what they would do and how they envisage to have a positive working environment. So I'm very positive and I feel very well when I think about the future of the respectful workplace issues as a continuation of what we have achieved in the last 1 year. Okay.
Thanks so much, Dr. Jakob and Alison, for those questions and answers. I can see we've got a question from one of the reporters who we have connected online, Chetan Bhattacharjee from Health Policy Watch. If you can unmute yourself, go ahead and ask your question. Even better if you can turn your camera on and then we can see you.
Okay, hi, good morning. Hi, so I'm Chetan Bhattacharjee from Health Policy Watch in Geneva. What is the status of the complaints against Dr. Kasai, and is there any kind of compensation or aid for the complainants who may have suffered? And a follow-up question on what are the steps that have been taken to undo the toxic work culture? If you could elaborate on that, please.
Sorry, Chetan, the quality of the audio here in the room is not brilliant. Just think we've got most of your question, but we're just going to try to adjust the volume here in the room a little so that Dr. Jakob can maybe hear a bit better. Sorry, we're going to ask you if you could kindly just repeat one more time. Thank you.
Sure. Is the audio better now? Should I go ahead?
It's, as you know, it's always a challenge on Zoom, but if you're able to just
Okay.
speak as slowly and clearly as you can, we will do our best to make sure it comes through. Thanks.
So my question is, what is the status of the complaints against Dr. Kasai? And is there any kind of compensation or aid for the complainants who may have suffered? And a related question, what steps have been taken to undo the toxic work culture? If you could elaborate on those, please.
Well, the process against Dr. Kasai was finished. There was an investigation, and this resulted in the fact that he left the organization. And that's finished on our side. There is no continuation to this. And learning from that experience and also from all the discussions with the staff, we started and introduced this Respectful Workplace Initiative, which has several areas of work that we are focusing on. First of all, we are very much focusing on what are the WHO values and how we use these values in our work. We are focusing on the introduction of the Code of Conduct and Code of Ethics, which are global documents and need to be addressed and introduced in every part of the organization, and we are working on that. Then WHO has a large number of zero tolerance policies, like zero tolerance on abusive behavior, zero tolerance on sexual harassment, zero tolerance on fraud and financial mismanagement, just to mention a few. And these policies are obligatory for everybody. And we also have systems and mechanisms in place on how staff members can report if they find or face any incidents. And we are strengthening these mechanisms and the knowledge among the staff members so that if they see anything happening that they don't want to accept, then they know how to address it and how to report it. And this is a very important thing, partly reporting to headquarters, but also we have invested quite a lot into strengthening our abilities and capacities at the regional office and the county offices, particularly on sexual misconduct and sexual exploitation. And then one more important aspect of this work is also the fact that there is a huge work pressure on our staff in the regional office, which is also partly due to the fact that there is a very heavy administrative procedure in place. So we looked at all the administrative processes. We had a full overview of how we can simplify and reduce the administrative processes. And we have come up with an action plan also for that. So I would say that our work on this area has several elements. And one of them is also the reduction of administrative procedures, but the other one is the cultural and behavioral change that we need to promote and progress in this organization. And I think this was a major element of our work in the last 1 year. And for this, we have now an action plan, and we know what we want to achieve while I am here until the 1st of February. But we are also making a medium and long-term action plan that we will hand over to the new regional director. And there is no compensation for the staff. That was another other question. The compensation is that we make sure that this will never happen again. But we do not have a policy in place in WHO which provides any compensation for any of these unrespectful behavioral issues. Thank you.
Thank you so much. Anyone else in the room or online who has questions, please raise your hand, physical or virtual, and we will come to you. Yep.
I'm JC Pa from TV5. So yeah, I have to ask this because it's bare months already. And recently, or I think in September, infections in COVID began increasing again here in the country? Do we fear that the infections might balloon, considering that by month end, we have barangay and SK polls. Come November, it's All Saints Day. In December, holiday gatherings will happen. Do we fear that infections might increase, considering that there is no longer vaccinations here in the country, COVID vaccinations?
Thank you for the question, JC. I'm going to hand over to Dr. Oluwakure to answer that one, if we can get him a roving mic, Vicky. Thank you.
Thank you very much. Thanks very much for the question. I think very pertinent question as well. We, as you say, we are in the Ber months, and so September, October, November, December. And so traditionally, we would see an increase in cases of respiratory infections. But currently, when we look at COVID-19 across the region, what we are seeing is a reduction in the number of COVID-19 cases, I think around 65% compared to last month. And so, which is a good thing. Also a reduction in number of deaths overall as well, is about 35%. And so really that is what we are seeing. We've not noticed a significant increase in cases of COVID-19 within the Philippines itself. And so I think that's also a good thing. And that, I think, also speaks to the precautionary measures which we are still taking. And you will have noted that there are still many people wearing masks as they go about their daily business, which is clearly one of the recommendations that we make. Hand washing, keeping the physical distance as well. And if you're not feeling well, consulting with your doctor or staying at home until the symptoms subside. And so all of these things are clearly all heading in the right direction. And we would anticipate that the government is also looking at all these mass gatherings that are upcoming, and that they would then, with WHO support, be able to ensure the health of the population over the coming festivities. Of course, you didn't mention Christmas as well. So Christmas is also on the horizon, and we will see a lot of travel at that time as well. And so we would also recommend that when people are traveling, that they should also take similar precautions as they go about their business during the festive season. Thank you very much.
Thanks so much, Dr. Oluwakure. Any other questions here in the room or online? Now is your moment. We've got one online, have we? Sorry, it's a bit difficult for us to see. If you can just let me know who or whoever has a question online, you're welcome to unmute yourself and ask. You have a follow-up question from Policy Watch. Go ahead, Chetan.
Hi, sorry, it's me again. Dr. Yaqub mentioned new rules and systems of checks, especially against sexual misconduct and exploitation. There have been several cases within the WHO in recent years. So just wanted to know if there's an update on the status of those allegations, please.
This is a global issue, and actually this was started at the global level by Dr. Tedros after the events in one of the African countries. And there is a very strong global policy in place, and a very strong global leadership in place. And whatever we do here in the global region either emanates from the global leadership or it contributes to that. So I would like to assure you that this is a piece of work that is everywhere in the organization, a high priority, led by Director General and the regional directors. And in our region particularly, we reached out also to all the country offices, and we have worked very closely with the WHO representatives in the country offices. And following some global guidance and regional guidance, we worked with them to develop a country-by-country action plan, which they are just finalizing now. And we have received a number of action plans already from the WRs, and we are hoping to do that by mid-November, which is our global deadline. So every country and every regional office will have a strategy or action plan in place. And I would say that we are already very well progressing in our region to make sure that this is already in place. and we had lots of training and capacity building courses with the staff, both in the regional office and also in the country offices. And we made them aware of what they can do in case they face an incident of sexual harassment. So I would like to reassure you that both the policies, but also systems and mechanisms for this are in place. Thank you.
Thank you so much. And I can see that Jenny Ravello from DevEx, who's online, also has her hand raised. So Jenny, go ahead and unmute yourself, and even better if we can see your face, but if not, no problem. Go ahead.
Thank you, Liv. Yes, good morning. I just want to build on Dr. Jacob's response earlier. Dr. Jacob mentioned about introducing policies to ensure there's zero tolerance for abusive behavior and there's respectable workplace at the regional office. But can you give an example how practically that's being done now versus before, like, some examples of changes exactly? And you've led the office for quite some time. What do you see are challenges ahead on this particular area for the next RD? And just last on that, have you done a staff survey to kind of understand how they felt about whether things have improved? Thank you so much.
Yes, we are doing staff survey regularly, and we have also done one recently. And initially, we focused on these issues to the county offices, but then we decided, following some discussion in town hall meetings with our staff here, to focus also on the regional office. And we had two colleagues who were working with us who reached out to every staff member who wanted to meet with them. And we have gathered all the feedback from the staff in the regional office as well on what are still the outstanding issues and the burning issues, and we are addressing these. So the staff survey definitely is an issue. We have regularly town hall meetings because we believe in the involvement of staff in such problems and to listen to them. And in the town hall meetings, we usually have this Slido system where staff can also, without a name, anonymously announce any issues that they face with, and that is quite helpful to address them. Plus, I also have the open hours, and any staff member from the office can come to see me if they have any problems with disrespectful or abusive issues in the office. And it was very helpful, I must say, because this helps us to identify the incidents that still exist, and the number is going down, and that was very good for me to see. And whenever we noticed an incident like this, we took action immediately. So I think lots of things ongoing. There are some divisions where they have also introduced a regular meeting on how to address the values and how to integrate the values into the work of that division and into the daily life of the staff. And that is also one of the good and positive practices. And we report back on all these elements to the regional committee next week. We will also have a separate session where we bring in the staff themselves who can report their experience on this as well. So all this will be on the agenda next week. Did I miss anything? No, thank you.
Anything further, either online or in the room? If not, we're going to thank you all for joining us this morning, this afternoon, wherever you are, this evening, I think for some. You are, of course, very welcome to follow the regional committee meeting as it happens next week. It's going to be live streamed on all of our platforms other than the private session on the nomination of the regional director. But as mentioned, we will announce publicly as soon as we have the result of that. A little bit difficult to predict the exact timing, but late afternoon, probably sometime Tuesday, and we will send out a notification to our media list as soon as we have an idea of when that will happen. We might be able to give you 5 to 10 minutes notice. So there's also copies here physically for those who are here in the room with us of some of the documents like the timetable for next week for those who are going to follow, also some fact sheets on some of those 4 technical agenda items that Dr. Jakob briefed you on, also information on the candidates for regional director who are running, of course. Those who are online, all of this is available on our website. Anyone who has any questions or concerns in follow-up, please don't hesitate to reach out to our team. We're always here to help. Thank you very much and look forward to seeing you again soon.